Thank you very much, Mr. Chairman, and thank you to the witnesses for testifying before the subcommittee today. This hearing could not come at a more important time with the House considering H.R. 27, the Halt Fentanyl. Let me repeat that, fentanyl, not fentanyl, the Halt Fentanyl Act, which I proudly co-sponsor. Let me also say that it's critically important that it is a bipartisan hearing, and it would have been very helpful to have bipartisan support for securing our southern border and reducing the flow of fentanyl precursors into this country, especially through Mexico, and as you've heard, incentivized by the Chinese Communist Party to send fentanyl precursors to this country. According to the CDC data, we lost more than 110,000 Americans to drug overdose deaths in 2022. It's estimated that 75% of these deaths involved opioids, meaning that 226 Americans died every day to opioids. While many cases of drug-related deaths are poisoning, where the individual does not know the product they are about to use is laced with another substance like fentanyl, more needs to be done to prevent addiction, including minimizing unnecessary exposure to opioids. And as a director of public health and as a state senator, I was very influential in getting substance use disorder treatment, as well as reducing pre-authorization to medicated-assisted treatment for substance use disorder, as well as trying to stem the flow of opioids. 90% of acute pain patients receive opioids to manage their pain, whether they need them or not. Between 2011 and 2019, opioid prescriptions decreased by 40%, from approximately 250 million to 150 million prescriptions dispensed. This is true across most payer audiences, Medicaid, private, and cash patients. However, among Medicare patients, opioid prescribing actually increased. Medicare's share of opioid prescribing during this time increased substantially from approximately 20% to the country's opioid prescriptions in 2011 to 35% in 2019. This represents a 75% increase in just under a decade. We clearly have more work to do in Medicare to make sure that patients have access to effective pain relief agents while also not unnecessarily exposing them to narcotic painkillers. One way to do this would be to increase access to non-opioid pain management medications, which I'm proud to accomplish with my legislation, the Alternatives to Pain Act. This legislation, which I thank Congresswoman Berrigan for co-sponsoring and co-leading, would decrease barriers to accessing non-opioid pain management alternatives that are FDA approved. Dr. Westlake, thank you for testifying today. Do you agree that prevention needs to be part of our strategy to combat illicit drug use and addiction?
Absolutely.
Do you believe that our current reimbursement policies appropriately align incentives to ensure patients have access to opioids and non-opioid pain management alternatives?
Yeah, I think it's important to make sure that they're cost-effective solutions.
And do providers have the education and resources available to know what other alternatives could be available?
I think so. Okay.
Do you agree or think that patients should not be forced to fail first on an opioid before being given the option to use a non-opioid to treat their pain if a non-opioid is prescribed by their doctor?
Yeah, that seems counterproductive.
And how would you suggest Congress work to appropriately align incentives to ensure seniors have access to novel, non-opioid pain management alternatives, especially in the post-acute hospital care setting or as they're discharged from the emergency room?
Right, I think you again, try to encourage non-prescription solutions, non-prescription drugs, but also to make sure that there's some parity in the cost pricing structure.
Thank you. Switching gears, I'd like to focus on another critically important issue that pertains to people purchasing drugs over social media applications, especially our youth. The U.S. Centers for Disease Control and Prevention recently published an analysis finding a 182% increase in illicit fentanyl poisoning or overdose deaths among 10 to 19-year-olds between 2019 and 2021. Again, our condolences, Mr. Cohen. Counterfeit prescription pills were present in nearly 25% of deaths. The DEA released an updated public safety alert finding that 6 out of 10 fentanyl-laced counterfeit prescription pills contained a potentially lethal dose, which was an increase from the agency lab's analysis from 2021 when the rate was 4 out of 10. Sheriff Bouchard, as a result of online sales, do you think a framework like the one I outlined in platforms directing social media, such as the Cooper Davis and Devin Norring Act, would be helpful in reducing these tragic deaths?
Yes, I think we have to look at the component of what technology and social media companies are doing and taking part now, especially as many of them have moved or have already moved to end-to-end encryption. We know that that's a big challenge on so many levels, and many of them are resistant, if not outright obstructionist to law enforcement, even with a valid search warrant.
Thank you so much. I see my time has expired. I yield back.